the habit that's silently destroying your teeth. I need to tell you something you've probably never stopped to think about. And being completely honest with you from the very beginning, it might feel a little uncomfortable at first. It might sound like I'm exaggerating. You might even think, that's not me, I take care of my teeth. But I'm asking you one thing. Stay until the end. Because what I'm about to show you today completely changed my relationship with a habit I had been practicing since I was a child, without ever questioning it. A habit so obvious, so automatic, so deeply ingrained, that the mere idea of challenging it had never even crossed my mind. What if the thing you do every single day to protect your teeth is silently doing exactly the opposite? I know. It sounds strange. But stay with me. The moment everything stopped making sense. I was probably around 30 years old when something started to feel off. Nothing dramatic. Nothing that would send me running to the dentist in a panic. Just a small, quiet signal that kept showing up and refused to go away. A light sensitivity when I drank something cold. A brief, sharp twinge when I ate ice cream. A faint discomfort after my morning coffee that I kept brushing off, no pun intended, as something temporary, something that would pass. But it didn't pass. And here's the part that genuinely confused me. I was doing everything right. Or at least, everything I had been told was right. I brushed my teeth after every meal. I used fluoride toothpaste. I flossed regularly. I didn't drink soda every day. I went to the dentist twice a year. By every metric I had been given, I was the model patient. So how was it possible that someone who followed every rule in the book was still experiencing sensitivity, discomfort, and that nagging feeling that something wasn't quite working? That's when the questions started to eat at me. What if the rules themselves were the problem? The lie we were all told. Let me take you back to when you were a kid. At some point, whether it was a parent, a teacher, a dentist, or a cartoon on Saturday morning, someone told you that brushing your teeth was important. And that message got reinforced over and over and over again until it became one of those unquestionable truths. One of those things you just do. Wake up. Brush your teeth. Eat. Brush your teeth. Go to bed. Brush your teeth. Nobody ever really explained why, beyond the vague idea that it keeps your teeth clean and prevents cavities. Nobody explained how to brush correctly. Nobody warned you about the very real ways that brushing incorrectly could hurt you. They just told you to do it. Frequently. Thoroughly. And with conviction. And so we all grew up believing that more was better. More brushing sessions. More toothpaste. More pressure. More scrubbing. More. But here's what nobody told you. There is such a thing as too much. And too much in the wrong direction doesn't just fail to protect your teeth. It actively damages them in ways that can take years to reverse, and in some cases can never be fully reversed at all. That's not a scare tactic. That's just the science. Understanding what's actually happening in your mouth. To really understand why so many people, despite brushing every day, are dealing with sensitivity, wear, and cavities, you need to understand something about the structure of your teeth. Your teeth are made up of several layers. The outermost layer is called enamel. You've probably heard of it. It's the hardest substance in the entire human body, harder than bone, in fact. It's the transparent or slightly white shell that protects everything underneath. And its job is to act as a shield against everything you throw at it. Acids, bacteria, temperature, pressure. Beneath the enamel is a layer called dentin. Dentin is softer, more porous, and packed with tiny microscopic tubes called dentinal tubules. These tubules lead directly toward the nerve of your tooth. And when dentin becomes exposed, when that protective enamel layer above it starts to wear away, those tiny channels essentially become open pathways that connect the outside world directly to the nerve inside your tooth. Cold liquid, hot coffee, sweet dessert, the pressure of a bite. All of it travels straight to the nerve. That's tooth sensitivity. And here's the part that changes everything. Enamel does not regenerate. Once it's gone, it's gone. Your body cannot grow it back. The human body is remarkable in many ways. It heals cuts, repairs broken bones, regenerates entire layers of skin, but it cannot regrow dental enamel. That protective layer you're born with is the one you have for life. So every tiny bit of enamel you lose, whether from acid erosion, abrasive toothpaste, or aggressive brushing, is permanent. Irreversible. Done. The question is, are you losing it faster than you should be? The hidden culprit, how you're brushing. The most common and least talked about cause of premature enamel loss isn't sugar. It isn't soda. It isn't even skipping the dentist. It's the way most people brush their teeth. Let me paint you a picture. You've just finished dinner. Maybe you had something slightly acidic, a glass of orange juice, a tomato-based sauce, a piece of fruit. You head to the bathroom, grab your toothbrush, load it up with toothpaste, and start scrubbing. You go back and forth with decent pressure, because you want to make sure everything comes off. You're thorough. You're committed. You do this for 2 minutes, maybe more. And then you rinse, look in the mirror, and feel good about yourself. Here's what's actually happening on the surface of your teeth. Every time you apply that lateral, back-and-forth scrubbing motion with significant pressure, you're not just removing plaque. You're creating microabrasions on the surface of your enamel. These are tiny scratches, invisible to the naked eye, that accumulate over months and years. Over time, they don't just scratch the surface, they begin to wear it down. Studies published in dental research journals have consistently shown that horizontal scrubbing motions combined with medium or hard bristle toothbrushes cause significantly more enamel erosion than the brushing techniques recommended by dental professionals. And the damage isn't always visible in a mirror or even detectable on a standard dental X-ray until it's already quite advanced. The worst part? It feels productive. The harder you scrub, the cleaner your mouth feels immediately afterward. The sensation of pressure and friction registers in your brain as effective. So you keep doing it. You might even do it harder, thinking you're doing better. That feeling of cleanliness is real. But the cost you're paying for it, in terms of enamel erosion, is also real. The brushing technique that actually works. So what should you be doing instead? Dental professionals have been recommending the modified base technique for decades, and yet very few patients are ever actually taught it properly. Here's how it works. You hold your toothbrush at a 45-degree angle to the gum line, not flat against the teeth, but slightly angled so that the bristles can reach just underneath the edge of the gum. Then, instead of scrubbing back and forth, you use short, gentle, circular, or vibrating motions. Just a few millimeters of movement. You work systematically around the mouth, spending about 2 seconds on each small area before moving to the next. The bristles are doing the work. The pressure is light, barely more than the weight of the toothbrush itself. You're not scrubbing. You're guiding. And when you move from the gum line area to the surface of the tooth itself, you gently sweep the bristles upward, for lower teeth, or downward, for upper teeth, to clear away what you've loosened from the gum line. This action actually helps remove plaque from both the gum margin and the tooth surface at the same time. It takes about 2 minutes. It uses very little pressure. And it does significantly more good and significantly less harm than the way most people currently brush. The difference in how your mouth feels afterward is subtle at first. But over weeks and months, the reduction in sensitivity is noticeable. The gums stop receding. The enamel stops wearing down. And the foundation of your dental health, which is what you're actually trying to protect, gets stronger instead of weaker. The bristle problem nobody talks about. Now let's talk about your toothbrush. Walk into any pharmacy or supermarket and look at the toothbrush aisle. You'll find 3 categories: soft, medium, and hard. And for most people's entire lives, medium has felt like the right choice. Not too gentle, not too aggressive. Moderate. responsible, effective. But here's what the research actually says. The American Dental Association, the British Dental Association, and virtually every major dental organization in the world recommends soft-bristle toothbrushes for the vast majority of people. Not medium, soft. And not because soft bristles are somehow weaker or less effective at removing plaque, they aren't. But because soft bristles are flexible enough to conform to the shape of the tooth and gum line, allowing them to clean effectively without inflicting unnecessary physical trauma on the enamel and gum tissue. Medium and hard bristle brushes feel more aggressive because they are more aggressive. And with most people's brushing technique, which, as we've already established, tends to involve too much pressure, that aggression gets compounded. Medium bristles plus excessive pressure equals accelerated enamel erosion. It's a simple equation. Soft bristles, on the other hand, absorb and distribute the pressure more gently. They reach into the spaces between teeth and along the gum line without the same level of abrasive force. And used correctly, they're just as effective, often more effective, at removing plaque and preventing gum disease. If you're currently using a medium or hard toothbrush, switching to soft is one of the easiest, cheapest, most immediately impactful changes you can make today. It requires no new products, no special technique, and no dentist appointment. Just a different toothbrush. The timing mistake that multiplies the damage. Here's something else that almost nobody talks about, and it's something I got completely wrong for years. When you eat or drink something acidic, and this includes a lot of everyday foods and beverages, not just the obvious offenders, the pH level in your mouth drops temporarily. Your enamel, which thrives in a neutral environment, becomes temporarily weakened and more vulnerable to physical abrasion. In this softened state, your enamel is essentially at its most fragile. And what do most people do immediately after eating or drinking? They brush. I know. It sounds like exactly the right thing to do. You just ate, there's food and acid in your mouth, so you clean it up. Logical, right? Except that brushing your teeth in the 30 to 60 minutes immediately following acidic consumption is one of the worst things you can do for your enamel. You're taking an already softened, already vulnerable surface and applying abrasive friction to it at exactly the moment it's least equipped to handle it. The science is pretty clear on this. Multiple studies have documented the way post-meal brushing, particularly after acidic foods and drinks, accelerates enamel erosion in a way that brushing at a neutral time simply doesn't. The solution is simple. Wait. Give your saliva time to work. Saliva is your mouth's natural defense system. It remineralizes the enamel, neutralizes acid, and buffers the pH back toward a healthy range. Within about 30 to 45 minutes after eating, your mouth's chemistry has largely returned to normal, and brushing at that point is significantly less damaging. If you absolutely cannot wait, if you're heading into a meeting or about to go to bed and you don't have 45 minutes, rinse your mouth with plain water first. This doesn't fully solve the problem, but it dilutes the acid and begins the neutralization process, making subsequent brushing less harmful than it would have been otherwise. And if you're particularly concerned, rinsing with a fluoride mouthwash after the waiting period can provide an extra layer of remineralization support that strengthens the enamel even further. The acid list you need to know. Now, I mentioned acidic foods and drinks, and I want to be specific here because I think a lot of people are unaware of just how many everyday items fall into this category. The obvious ones are carbonated sodas and energy drinks, which are notoriously acidic. Citrus fruits, oranges, lemons, grapefruit, limes, are high in citric acid. Vinegar and vinegar-based dressings and condiments. Sports drinks, which despite their health-adjacent marketing, are often just as acidic as sodas. But then there are the less obvious ones. Coffee. Even black coffee, with no sugar or milk added, has an acidic pH. And given that many people drink coffee first thing in the morning and then brush their teeth immediately afterward, this is a genuinely significant issue for a lot of people. Red and white wine. Tomatoes and tomato-based sauces. Pickled foods. Many fruit juices, even healthy ones like apple juice or pomegranate juice. Yogurt. Certain sparkling waters. I'm not suggesting you eliminate all of these from your diet. That would be both impossible and unnecessary. What I am suggesting is that you become aware of the pattern. If you drink coffee every morning, wait 30 to 45 minutes before brushing. If you have a glass of wine with dinner, let your saliva do its work before you head to the bathroom with your toothbrush. Small awareness. Big difference. The pressure problem. Are you applying too much force? One of the most reliable indicators that someone is brushing too hard is something dentists call toothbrush abrasion. This shows up in a few specific ways. The most visible is gum recession, the gradual pulling back of the gum tissue away from the teeth, which creates that long tooth appearance that many people associate with aging, but which is actually, in many cases, caused by years of aggressive brushing. Once the gum has receded, it doesn't grow back on its own, and the exposed root surface, which isn't protected by enamel the way the crown of the tooth is, becomes highly sensitive and much more vulnerable to decay. Another sign is notching at the gum line. Small, shallow grooves that form at the base of the teeth where the brush makes the most contact during a scrubbing motion. These notches are literally carved out of the tooth surface by the repeated mechanical force of the bristles. A third indicator is where on the outer surfaces of the back teeth, the premolars and molars, where the brushing action tends to be most vigorous. If you look in the mirror and any of these signs are already present, it doesn't mean you failed. It means you have information. And information, in this case, is exactly what you need to make a change before the problem progresses further. The fix is straightforward. Lighten up. Use only as much pressure as you need to keep the bristles in contact with the tooth surface. The cleaning is done by the brush and the bristles, not by the force you apply. If anything, heavy pressure counterproductively flattens the bristles and reduces their ability to reach into the crevices and spaces where plaque actually hides. What the right toothpaste actually does. Let's spend a moment on toothpaste, because there's a lot of marketing noise in this category and not a lot of clarity. The most important ingredient in any standard fluoride toothpaste is, predictably, fluoride. Fluoride works by remineralizing enamel, essentially helping to reverse the early stages of the demineralization process that happens every time your teeth are exposed to acid. It binds to the enamel surface and makes it more resistant to future acid attacks. For most people, a standard fluoride toothpaste is genuinely effective and genuinely protective. What many people don't realize is that the whitening toothpastes, the ones that promise dramatically whiter teeth in a matter of days, often achieve their whitening effect through the inclusion of abrasive particles. These particles physically scrub stains off the tooth surface. And yes, that can make your teeth look whiter. But those same particles, used every day by a person who already brushes with too much pressure, can contribute to enamel wear. If you're dealing with sensitivity and you currently use a whitening toothpaste, switching to a sensitivity-formulated toothpaste is worth considering. These products contain compounds like potassium nitrate or stannous fluoride that work by either blocking the dentinal tubules, those microscopic channels to the nerve, or by desensitizing the nerve over time. They won't reverse the underlying cause of sensitivity that still requires correcting your technique, but they can provide meaningful relief while your enamel gets a chance to recover. The electric toothbrush question. A question that comes up constantly. Is an electric toothbrush actually better? The short answer is, for most people, yes, but not for the reasons you might expect. The primary advantage of a good electric toothbrush isn't that it cleans better than a manual brush per SE. A manual brush, used with correct technique and appropriate pressure, is entirely capable of keeping your teeth clean and healthy. The real advantage of electric toothbrushes is that they take technique largely out of the equation. Most modern electric toothbrushes, particularly the oscillating rotating type or the sonic type, are designed so that you simply need to guide the brush from tooth to tooth. The brush head does the motion. You don't scrub. You don't apply force. You just move it slowly around the mouth and let it work. Many premium models also include pressure sensors that alert you, usually through a light or a pulsation change, when you're pressing too hard. For people who have been habitual overpressers for years, This feedback can be genuinely transformative. If you're currently a manual brush user and you're experiencing sensitivity or gum recession, upgrading to an electric toothbrush with a pressure sensor is probably one of the highest return investments you can make in your dental health. Not because it's magic, but because it removes the most common variable, human technique, from the equation. The flossing component you can't skip. Everything we've discussed so far has focused on the tooth surface. But roughly 40% of each tooth surface is in the tight contact areas between adjacent teeth, areas that a toothbrush, no matter how sophisticated, simply cannot reach. This is where flossing comes in. And before you close this tab, I know, nobody wants to talk about flossing. It's the vegetable of dental hygiene. Everyone knows they should do it. Almost nobody does it consistently. And when people do it, they often do it in a way that's more symbolic than effective. Here's the thing about flossing that most people don't understand. Its primary purpose isn't just food removal. It's plaque disruption. The thin biofilm of bacteria that colonizes the surfaces between your teeth, the same bacteria that produces the acids responsible for cavities and the toxins responsible for gum disease, needs to be physically disrupted at least once every 24 hours to prevent it from hardening into calculus, which can only be removed by a dental professional. A toothbrush cannot reach those surfaces. Mouthwash alone cannot adequately disrupt the biofilm. Only physical contact, whether from dental floss, a water flosser, or an interdental brush, can do that job. The technique matters here too. Proper flossing means curving the floss into a C shape around each tooth and sliding it gently up and down against the tooth surface, not just snapping it through the contact point and calling it done. When you use that C shape, you're cleaning not just the contact point between teeth but also the edge of the gum, where plaque accumulation is particularly dangerous. If traditional floss is difficult for you, if you have tight contacts or limited dexterity, water flossers are a genuinely effective alternative. Research has shown them to be comparable to traditional floss for reducing plaque and gingivitis in most patients, and for people who won't floss at all otherwise, they represent a massive improvement over nothing. What your sensitivity is actually telling you. I want to come back to something I mentioned at the beginning, because I think it's one of the most important points in this entire conversation. Dental sensitivity is not the problem. It's the signal. Your body, specifically the intricate nerve network inside your teeth, is not generating that sharp, shooting twinge for no reason. It's communicating. It's telling you that somewhere in the chain of habits and choices and products and timing, something has gone wrong. Something is allowing stimulus to reach a nerve that should be insulated. Something has compromised the protective architecture that's supposed to stand between the outside world and the sensitive interior of your tooth. The tragically common response to sensitivity is to ignore it. Or worse, to brush even harder, in the mistaken belief that the discomfort means there's something on the tooth that needs to be scrubbed away. That instinct is understandable. It's just completely backward. When you feel sensitivity, the right response is to slow down, to lighten up, to ask yourself what has changed in your mouth or your routine, to schedule a dental appointment if the sensitivity is new, sharp, or increasing, and above all, to see it as information rather than an inconvenience. Because the teeth that are sending you that signal right now are doing you a favor. They're giving you a window, a chance to intervene before the damage progresses beyond the point of easy correction. The people who miss that window, who dismiss the signal as nothing, are the ones who end up in the dental chair years later, dealing with problems that could have been addressed simply and cheaply at an early stage. The dentist visit you keep postponing. Let's talk about professional dental care for a moment, because it's inseparable from everything else we've discussed. Brushing and flossing at home, no matter how perfectly you do it, cannot accomplish everything that needs to be done to maintain long-term dental health. Professional cleaning removes calculus, the hardened deposits of mineralized plaque that accumulate in areas a home brush simply can't reach, regardless of technique. Calculus is porous and rough, and it harbors bacteria that continuously damage the gum tissue and the structures that support the tooth. Professional cleanings also give your dentist the opportunity to catch problems early. Cavities caught at the enamel stage are tiny, inexpensive interventions. The same cavity, caught 6 months or 2 years later, may require a root canal or an extraction. The math of proactive dental care is brutally simple. It is always less expensive, less painful, and less time-consuming to prevent or treat problems early than to manage them after they've advanced. Many people avoid the dentist because of cost, anxiety, or the perfectly human tendency to avoid receiving bad news. All of those motivations are understandable. None of them change the underlying calculus. Regular professional care, typically twice a year for most people, though your dentist may recommend a different frequency based on your individual risk, is not optional if you want to maintain a healthy mouth over the long term. Building a routine that actually works. So what does a genuinely healthy dental routine actually look like? Let me put it all together. In the morning, wait until about 30 minutes after eating or drinking, including coffee, before brushing. Use a soft-bristle toothbrush, angled at 45 degrees to the gum line, with light pressure and small circular motions. Spend about 2 minutes total, making sure you cover all surfaces of all teeth, including the backs and the chewing surfaces. Use a standard fluoride toothpaste or a sensitivity toothpaste if that's relevant for you. After brushing, don't rinse immediately. Let the fluoride sit on your teeth for a few minutes to maximize its remineralizing effect. In the evening, floss before you brush. This is important. Flossing first loosens debris and plaque from between the teeth, and then brushing sweeps it all away. If you brush first and then floss, you may be pushing material back into the freshly cleaned surfaces. If you use mouthwash, use it at a separate time from brushing, not immediately after. Many fluoride-containing mouthwashes are best used mid-morning or mid-afternoon, not right after you've just applied fluoride toothpaste, since you'd essentially be rinsing away what you just applied. Drink plenty of water throughout the day. Water rinses away food particles, hydrates the salivary glands, and helps maintain the neutral pH environment that enamel prefers. If you can drink fluoridated water, all the better. And see your dentist regularly, without waiting for pain. The bigger picture. When I look back at the years I spent brushing the wrong way, with a medium bristle toothbrush, too much pressure, immediately after drinking coffee, I don't feel regret so much as a kind of stunned disbelief. I was doing something every single day. I was being consistent. I was making an effort. I had the intention of protecting my health. And it was hurting me. Not dramatically. Not all at once. But slowly, imperceptibly, in ways that accumulated until they produced those small but insistent signals I could no longer ignore. The sensitivity wasn't my enemy. The sensitivity was the messenger. And what it was telling me was this: the intention to do something right is not the same as actually doing it right. Frequency is not the same as efficacy. Effort is not the same as effectiveness. This is true in dental health. It's also true in virtually every other domain of life. The habits we perform on autopilot, the ones so ingrained we never question them, are often the ones most worth examining. Because they're the ones that, for better or for worse, are shaping our reality every single day. Your teeth are trying to tell you something right now. The question is whether you're listening. And the good news, the genuinely good news, is that most of this is fixable. A softer toothbrush. A gentler technique. 30 minutes of patience after your morning coffee. A bit of floss before bed. A dental appointment you've been postponing. None of this is complicated. None of it is expensive. None of it requires a dramatic overhaul of your life. It just requires the willingness to pause, to question, and to do something just a little better than you were doing it before. Because in the end, it's not about doing more. It's about doing it right. And when you finally do, when you make those small, evidence-based adjustments to a habit you've been performing on autopilot for years, something shifts. The sensitivity fades. The discomfort disappears. That nagging signal from your nervous system finally goes quiet. Not because you ignored it, but because you listened. If this content made sense to you, if something here clicked in a way it hadn't before, subscribe to the channel. Because in the next videos, I'm going to keep pulling back the curtain on the small, invisible details, the ones nobody talks about. That might be affecting your health far more than you realize. And in the description, I've left a link to a practical guide that takes everything we covered here and puts it into a simple, actionable format you can start using today. Because your health deserves more than a habit you inherited at 7 years old and never thought to question again. Start questioning. Start adjusting. Your teeth will thank you.